Mr. Guthrie is recognized for his time.
Thank you, Madam Chair, and thank you for all being here. And just so everybody knows, we've been having these meetings, if they're not been formal hearings, bipartisan with several of you over time. And I remember when we first started meeting about this, it might have been Dr. Fauci. I said I don't want to put words in your mouth if you didn't, but we are going to prepare for a pandemic. That's what the American people expect us to do. We're going to prepare for a pandemic. We're going to put things in place for a pandemic and hope and pray that it never comes. We're going to get ready. And as we prepare for it, people are going to see things, hear things, and maybe react that this pandemic is imminent when it may not be, because we're doing what we're supposed to do. The other thing is, I know the White House and the administration needs to reassure markets and marketplaces where we are and where we stand. And for everything that I've heard previously and what Larry Kudlow has said is not inconsistent, is where we are. But I know that the CDC came out and talking about the pandemic to be ready for it. And Secretary Azar, if you'd like to explain this, I know the CDC warned that Americans should, and I'll quote, prepare for community spread in the United States and should be ready for, quote, significant disruption. And would you explain what that means, what it means to the average person, what that means, and what's the most important message you would like for the American people to know about the current state of America and the coronavirus?
Our messaging from the president through to the career officials at the CDC has been consistent, but it's striking a balance. America's risk is low at the moment. That could change quickly. We are working to keep that risk low, but we have always been transparent that we expect more cases in the United States with a rapidly spreading virus, especially with what we've seen. For the average American, there's no change in their behaviors except what we always would advise, which is practice good public hygiene, washing your hands appropriately, coughing into your arm, not touching your face with unwashed hands, and appropriate preparedness activities at home. And you can go to cdc.gov for normal advice for flu seasons, hurricanes, and others. Good preparedness, good thoughtfulness at home. We're trying to be very transparent to people of the risks we face, even if we're at a low-risk situation now, so that so people aren't surprised, so that they know what we're dealing with and what uncertainties we're dealing with.
Thank you. And so Dr. Fauci and Dr. Redfield, for 50 days we've learned much about the coronavirus, but much is still unknown. What is the current, that's what I know people want to know at home, what is the current scientific consensus about the transmissibility, infectiousness of the virus, and how long, once you're infected, will you be infected, how long can you pass it on? And what are the other remaining known unknowns? What are the things you know that you would like to know the answer to with Dr. Fauci and Dr. Redfield, or Dr. Cadillac, if that's in your world?
First of all, we know it's a very transmissible virus. There are some viruses that are not efficient in going from human to human. What we learned early on, and we are convinced now, given what we've seen in China and other countries, that it's a highly transmissible virus. That's the first thing. The second thing, when you say how long a person is infected after they get infected, that's something that's still up in the air. And the way you get the answer to that is you try and isolate virus, what we call shedding, for a period of time. And we know that there are individuals who are actually able to transmit when they are without symptoms before they get symptoms. What we don't know yet, and I think we're going to get information from the group, including the CDC individual and one of my people who was in China with the WHO group, what the extent of that transmissibility is from an asymptomatic person. Is it minor, part of the driving of the outbreak, or is it significant? That's going to be a very important thing that is currently an unknown. And Bob, you want to take up?
I concur with Dr. Fauci. I think the biggest challenge we have right now is what is the relative infectivity, whether before you get sick, are you more infectious before you get sick, or are you more infectious after you get sick? We are tracking these patients that we do have in this country to see how long they actually have a virus that can be isolated from their respiratory secretions. It's probably going to be longer than many of us originally anticipated. I think at this stage we have an individual's out about 18 days from the time they initially actually got sick. So I think these are key questions, and we continue to try to get the data to answer them.
So are there other things that you are looking to know that you don't know, that you don't know that you're trying to find the answers to?
Well, I think one of the other areas from the CDC's point of view is try to understand the methods of transmission. Is it all respiratory transmission through droplets? Is there fomite transmission? For example, can this virus survive on certain surfaces long enough for somebody else to come down, put their hand down, and then touch their face? It's not clear right now what the relative components of, say, droplet transmission is to fomite transmission.
Thank you. My time's expired. I'll yield back.